Hello and welcome to our channel. Today, we're going to delve into a topic that is both important and often misunderstood: dementia. We'll be discussing the early signs of dementia, what they mean, and how to recognize them. Remember, this video is meant to provide general information and should not be used as a substitute for professional medical advice. If you or a loved one are experiencing symptoms, please consult a healthcare professional. Understanding dementia. Dementia is not a specific disease. It's an overall term that describes a group of symptoms associated with a decline in memory, reasoning, or other thinking skills. There are many types of dementia, but Alzheimer's disease is the most common. Alzheimer's accounts for 60 to 80% of cases. Vascular dementia, which occurs after a stroke, is the second most common type of dementia. But there are many other conditions that can cause symptoms of dementia, including some that are reversible, such as thyroid problems and vitamin deficiencies. Dementia is often incorrectly referred to as senility or senile dementia, which reflects the formerly widespread but incorrect belief that serious mental decline is a normal part of aging. Early signs of dementia. Now, let's discuss the early signs of dementia. These signs can be subtle and may not be immediately obvious. They often start with memory problems, but can also include changes in mood, difficulty with complex tasks, and problems with language. Sign 1. Memory loss. This is often one of the first signs. It's normal to forget things occasionally, but with dementia, this forgetfulness becomes more frequent and starts to interfere with daily life. For example, forgetting recent conversations or events, misplacing items, forgetting the names of places and objects, or even forgetting what the items are used for. Sign 2. Difficulty with tasks. People with early dementia may struggle with tasks they used to find easy. This could be anything from cooking a meal to paying bills. They may struggle with following a series of steps, or they may take much longer to do tasks than they did before. Sign 3. Language problems. Another early sign can be difficult finding the right words. People with dementia may struggle to express themselves clearly, and they may stop in the middle of a sentence, unable to find the right word. They may also repeat themselves or struggle with language comprehension. Sign 4. Mood changes. Changes in mood or personality can also be a sign of dementia. This could be seen as increased confusion, depression, fearfulness, or anxiety. They may become irritable or notice a shift in their personality. Sign 5. Apathy. Early dementia can often result in listlessness, decreased motivation, or a loss of interest in activities or hobbies that they used to enjoy. Sign 6. Loss of ability to do everyday tasks. This could be forgetting how to do tasks that they've been doing their entire life, like tying their shoes or brushing their teeth. They may also struggle with coordination and motor functions. Sign 7. Confusion. People with early dementia may often get confused. When memory, thinking, or judgment lapses, confusion may arise as they can no longer remember faces, find the right words, or interact with people normally. Sign 8. Difficulty following storylines. Just as finding and using the right words becomes difficult, people with dementia sometimes forget the meanings of words they hear or struggle to follow along with conversations or TV programs. Sign 9. Repetition. Repeating daily tasks such as shaving or collecting items obsessively can be early signs of dementia. This is because the person may not remember that they've just completed the task. Sign 10. Repetitive behaviors. What are some potential indicators of early-stage dementia that involve repetitive behaviors like shaving or collecting items? Specifically, how does the person's inability to recall that they have already performed these tasks contribute to these signs? Well, the person may not remember that they've just completed the task, leading to repetition. This can be a clear sign of memory issues associated with dementia. Sign 11. Struggling to adapt to change. For someone in the early stages of dementia, experiencing change can be frightening because they have lost a chunk of their comfort zone due to memory loss. The person may require a strict routine and be afraid to try new experiences. Sign 12. Poor judgment. This can range from not understanding appropriate social behavior, forgetting to bathe, or having difficulty with decision-making. People with dementia may also fall for scams easily, as they may not be able to discern malicious intent. Sign 13. Misplacing things. People with dementia may put things in unusual places. They may lose things and be unable to go back over their steps to find them again. Sometimes they may accuse others of stealing, especially as the disease progresses. Sign 14. Visual perception issues. Some people with dementia may experience vision problems, difficulty reading, or issues judging distance or color. In some cases, they may not recognize their own reflection. Sign 15. Withdrawal from social activities. A person with dementia may start to withdraw from socializing due to changes they're experiencing. They might feel embarrassed or overwhelmed and therefore avoid being social. Remember, everyone is different, and not everyone will experience all of these symptoms. If you or a loved one are experiencing any of these signs, it's important to consult with a healthcare professional. Early detection can help manage the symptoms and improve the quality of life. In short, understanding the early signs of dementia can help in early detection and management. It's important to remember that dementia is not a normal part of aging, and it's not something that just happens. It's a disease that requires medical attention and care. If you or a loved one are experiencing any of these signs, please seek medical advice. Types of dementia. Dementia is a broad term that encompasses several types, each with its unique symptoms and progression patterns. Let's explore some of the most common types of dementia. Type 1. Alzheimer's disease. This is the most common type of dementia, accounting for an estimated 60 to 80 of cases. Alzheimer's disease is characterized by the formation of beta-amyloid plaques and tau tangles in the brain, which disrupt normal brain function. Early signs of Alzheimer's often include difficulty remembering recent events or conversations, and may progress to severe memory loss, confusion, and other major cognitive difficulties. Type 2. Vascular dementia. This type of dementia is often caused by a stroke or other conditions that block blood flow to the brain, causing brain cells to be deprived of oxygen and nutrients. Symptoms of vascular dementia can vary widely, depending on the severity of the blood vessel damage and the part of the brain affected. It often coexists with Alzheimer's disease, particularly in the elderly. Type 3. Dementia with Lewy bodies, DLB. Lewy bodies are protein deposits that develop in nerve cells in the brain regions involved in thinking, memory, and motor control. People with DLB may experience symptoms that closely resemble both Alzheimer's disease and Parkinson's disease, such as memory loss, physical stiffness, and visual hallucinations. Type 4. Frontotemporal dementia, FD. Unlike other forms of dementia that typically affect older adults, FD often occurs in people in their 50s and 60s. It's associated with degeneration in the frontal and temporal lobes of the brain, which control personality, behavior, and language. Symptoms often include changes in personality and behavior and difficulty with language. Type 5. Mixed dementia. This term is used when someone has more than one type of dementia. For example, they might have both Alzheimer's disease and vascular dementia. Symptoms may be a combination of those seen in different types of dementia. Type 6. Parkinson's disease dementia. This form of dementia occurs in some people with Parkinson's disease, usually in the later stages. Symptoms often include difficulties with memory, social judgment, language, or reasoning. Type 7. Creutzfeldt-Jakob disease. This is a very rare and rapidly fatal condition that impairs memory and coordination and causes behavior changes. Type 8. Normal pressure hydrocephalus. This type of dementia is caused by the buildup of fluid in the brain. Symptoms can include difficulty walking, memory loss, and inability to control urination. Type 9. Huntington's disease. This is a progressive brain disorder caused by a single defective gene. It causes changes in the central area of the brain, which lead to difficulties with movement, mood, and thinking skills. Type 10. Wernicke-Korsakoff syndrome. This is a chronic memory disorder caused by a severe deficiency of thiamine, vitamin B1. The syndrome is caused by the combination of Wernicke's encephalopathy and Korsakoff psychosis. Each type of dementia may have different early signs and symptoms, progression rates, and effects on the individual. However, there is overlap in many of the symptoms, especially as the diseases progress. It's important to get a comprehensive evaluation if you or a loved one are experiencing any signs of cognitive decline. Research into dementia and its various types is ongoing, with scientists worldwide working to find better ways to treat it, delay its onset, and prevent it from developing. Some of the most promising research areas include the study of the role of inflammation and the immune response in Alzheimer's disease, the use of advanced imaging techniques to study the brain and identify disease earlier, and the development of new treatment strategies based on understanding the genetics of Alzheimer's. Currently, there is no cure for most types of dementia, including Alzheimer's disease. However, there are treatment options that can slow the progression of the disease and manage its symptoms. These treatments can help improve the quality of life for those with dementia and their caregivers. Treatment often involves a combination of medications, cognitive training, physical activity, and sometimes behavioral therapies. Medications can help manage symptoms such as memory decline, sleep disturbances, wandering, agitation, anxiety, and depression. Cognitive training and physical activity can help improve function, while behavioral therapies can help manage specific behaviors. Non-drug therapies are also an important part of dementia care. These can include activities such as music and art therapy, which can help improve mood and reduce stress and anxiety. Physical activity and a healthy diet can also help improve overall health and well-being. In terms of future treatments, researchers are exploring a variety of exciting new approaches. These include immunotherapy, which aims to stimulate the body's immune system to fight off the disease, neuroprotective therapies, which aim to protect the brain from damage and loss of function, and regenerative medicine, which aims to stimulate the growth of new brain cells to replace those lost to the disease. It's important to remember that while these potential treatments are promising, they are still in the early stages of development. It will take time to fully understand their potential benefits and risks. Living with dementia can be challenging, but with the right support and treatment, people with dementia can lead meaningful and fulfilling lives. If you or a loved one are experiencing signs of dementia, it's important to seek medical advice as soon as possible. Impact on caregivers and families. Dementia doesn't just affect the person diagnosed. It also has a profound and lasting impact on their caregivers and families. The journey of caring for someone with dementia can be one of the most challenging experiences one can face, and it's important to acknowledge and understand these challenges. Firstly, the emotional impact can be significant. Watching a loved one struggle with memory loss and cognitive decline can be heartbreaking. Feelings of sadness, anger, frustration, guilt, and helplessness are common. Caregivers may also grapple with grief over the gradual loss of the person they once knew. Secondly, the physical demands of caregiving can be exhausting. This can include assisting with daily activities such as bathing, dressing, eating, and toileting. As the disease progresses, the person with dementia may need help with most or all daily activities, which can be physically demanding and leave little time for rest. Thirdly, there's the mental strain. Caregivers often have to deal with complex medical information, make difficult decisions about care, and manage challenging behaviors. This can lead to high levels of stress and increase the risk of mental health issues such as depression and anxiety. Financial strain is another significant impact. The cost of care for someone with dementia can be high, especially if professional or residential care is needed. This can lead to financial stress and uncertainty. Despite these challenges, many caregivers also report positive experiences. They may find strength they didn't know they had develop new skills, and experience a deep sense of purpose and fulfillment. Many also report closer relationships with the person they're caring for and other family members. Support for caregivers is crucial. This can include practical support such as respite care and home care services, emotional support such as counseling and support groups, and financial support such as funding for care services and financial planning advice. In conclusion, while dementia can be a challenging journey for caregivers and families, with the right support and resources, it can also be a journey of love, resilience, and profound personal growth. Thank you for watching.